talk to you about today is how pain works in the body. The purpose of the workshop is I'm going to tell you about how sciatica can be relieved through physical therapy. Not just relieved, but prevented. We're going to talk about the warning signs you may be getting sciatica, and then talk about the underlying causes behind sciatica and what the true causes of sciatica pain is. And then we're going to talk about why physical therapy is your best first choice for sciatica treatment. We are really the electrical and mechanical engineers of the body, if you really think about it. We understand how bones, muscles, nerves, and joints work together, connected to the electricity, which is the nervous system, and how it connects to the brain. So our job is to restore normal motion and retrain the brain to reduce pain. All these years that I've been practicing as a physical therapist, I've always had a passion for treating people that have not responded to conventional physical therapy. I've always wanted to help the patients that couldn't be helped, the patients that went from doctor to doctor. And I was always chasing this dream of treating complicated chronic pain patients. Sciatica is a very common condition that doctors diagnose very often for patients. And it's a term. The sciatic nerve is a nerve, and the sciatica part means inflammation of. But my job is to tell you guys why you have sciatica. Well, we all know that 50 to 75% of us are walking around with pressed nerves in our back on MRIs. Those MRIs are going to be positive. So really, what a physical therapist does is get to the underlying cause. And that's what we're going to be doing today. It's figuring out what movement pattern is causing your pain, what muscle dysfunction is causing your pain, and then figuring out how we can correct it very simply. No X-ray, no MRI, and no special test. Put a check mark in your head. I have pain when I roll in bed. Yes or no? Yeah. I have pain when I get up from a low chair or toilet and try to stand up. Yes or no? Check. I have pain when I am walking in the street, or not so much pain, but my leg feels tired and heavy. After I walk for a while, I feel like I can't carry my leg. Yes or no? Yes. I feel fatigue and sometimes a tingling, numbing feeling that may shoot down my thigh, in my inner thigh, outer thigh, in my buttock, or sometimes my calf even feels tight, like somebody's putting a tourniquet on my calf. Yes or no? Those are the signs and symptoms of sciatica. And you know what causes that? You guys can all sit down. So you just did your own self-diagnosis. What makes you feel better? What makes you feel worse? And we're gonna show you how I use that later in physical therapy treatment. But the sciatica nerve is the longest nerve in the body. Okay? It comes off of the lumbar plexus, which is the nerves that come off of the lower back. This is your lower back. These joints over here, L5 and S1, send these roots. These are called roots. These little things over here, these roots down, and they combine. Those roots combine into sensation nerves and motor nerves, nerves that give power. Okay? And they send that down into this big tube. And I want you just to imagine, look at this nerve. It's pretty big, right? Okay? That nerve goes down all the way down the leg and changes its name like a highway. I'm going to show you. You have a bulge here. There's a bulge sitting on that nerve at L5. You have a bulge here, and you have what they call degenerative disc disease. You ever heard that term before? Degenerative disc disease? It's a fancy term that basically means, in doctor lingo or medical lingo, that your discs are getting shorter. Everybody in this room has degenerative disc disease. I'm sorry to tell you, I don't need an X-ray to tell you that. We all have it. There's the SI joint right over here. The SI joint could be a generator of your pain. The X-ray may show, yes, that the SI joint is involved, but is that really the cause of your pain? It's a part of it, but it's not the whole cause. And the last one is, I have lumbar stenosis. Everyone's heard the term lumbar stenosis, right? Yeah. Lumbar stenosis basically means that this hole over here where the nerve comes out, it gets smaller and smaller as we get older, because we lose water in our discs. Just because the doctor or the MRI or the X-ray or the CAT scan or an expensive test tells you have stenosis, a structural problem, a bony problem, does not mean that it's over for you. It doesn't mean you're not going to get better. You know why? Because the new science of pain science, the evidence shows, the new research shows that all the structural tests that are being done for patients that cost a lot of money, all of a sudden don't really mean that much. They do mean something in one way. What they help the doctor do is decide if you have a disease. God forbid someone should have cancer, a tumor, an aortic aneurysm, something that is sitting in a place that shouldn't be, some sort of occupying lesion on a nerve. Yes, super duper rare. And how do you figure that? A doctor can just ask you the right questions. Hey, how do you sleep at night? Do you have night sweats? Do you have fevers? Have you had any sort of weight loss excessively? These questions will lead the doctor to know that they need to do, have you had a previous history of cancer? These things will lead the doctor to know that it's time to do that test. But a good physician could rule out a lot of these pathologies just by doing that mechanical exam. If you get worse with movement, that's what's causing your movement. Do the opposite movement, you feel better, that's the treatment. Okay? That's what a physical therapist does, a movement diagnosis. So without further ado, does everyone understand that there's medical diagnosis and there's physical therapy diagnosis? Physical therapy diagnosis is a movement dysfunction. Have you had acupuncture?
The second time I had sciatica, I went for 12 visits of acupuncture. He says to me, it'll take 12 visits, and just after 12 visits, the pain went away.
So I care more about his function. What can he do? He can't lift up his leg. He's weak. He's got pain. But let's take a look at his motion, if you don't mind. And then I'm going to do a quick scan on him like I did for you guys. And then I'm going to do a resetting of his nervous system real quick, some sort of manipulation, and see if we get a change on him. You guys want to give it a run and see? Okay, I'm taking a real chance going out on a limb here because he's a difficult case. Okay, he's not the typical like simple case where I can just pick someone out and they're like, you don't really have pain, so I can do some magic. But he's going to be a difficult case, so I'm putting myself on kind of like the hot seat right now to see if I can make this change on him. Okay, so let's come over here, and I have never treated him before. I just did the EMG on him to diagnose it. He's got a true sciatic neuropathy. As a physical therapist, if you know how to do a resetting of the nervous system, you might be able to make some changes in his function just because he's not loading that side up right. So let's take a look. So let's take a look at a couple of movements. So bend down, touch your toes as far as you can for me. And we can see that he's like barely bending down, right? Okay. All right, lean back as far as you can for me. I want to see his power, okay? So I'm going to have you just stand on one leg. So stand on one leg and I don't care. Stand, just lift this one up as high as you can. And you should be able to hold it for 10 seconds. Not bad. Okay. That side's loading pretty well, and he's okay. Switch, and then do the other side. See how long he can stand on this one for. Good. Let's try one more thing. So I want you to hold on to me, and I want you to squat down. So you should be able to come down and go down to a squat. So this is something I'm going to make a change on, or I'm going to make an attempt. Go ahead. Go ahead. See if you can get up there. Okay. Okay. Come with me. I got you. It's okay. Okay, push your foot down to the floor. This foot down to the floor. This is called neuromuscular re-education. Have you guys heard of that? Okay, that's a word they throw around in this business. Because I want you to pick your head up, straighten out your knees. We do a lot of re-education of muscles. We never just do straight up manual therapy. Go down. Yep. Go down. We want to re-educate the muscles that are weak. Keep going. And down. One more time. Excellent. Good. So I'm going to have you sit up. And just roll to sitting. Excellent. Okay. And swing your legs over. Great job. Okay. Are you doing dizzy? All right. Want some water or something? Okay. So let's have you stand up now. Okay. Let's have you just bend down. Can you touch your toes? Go ahead and bend down, touch your toes. Go down as far as you can. Keep going. Keep going, keep going, keep going, keep going, keep going. Good. So just do a squat for me. Don't be afraid. Just do it. All right. Can you get up? Come on, push. Okay, I barely held you. Did you see the difference? I mean, I'm not, do it again, do it again, do it again. Come on. Come on, get up there. Come on, come on, come on, come on. There you go. All right. Good job. All right, that is the typical kind of case that I like to see. I don't want the people that are vanilla, as they call it, right? Vanilla cases, they can go down the block to the physical therapist and get the ultrasound and the massage and the feel-good physical therapy. This is not feel-good physical therapy. Sometimes it hurts, sometimes it doesn't feel comfortable. when he said, I'm feeling that stretching, that's normal. What I was doing was actually getting his sciatic nerve. You guys floss your teeth? I was flossing I was pulling that sciatic nerve away from the roots to try to unlock it. It's been stuck for so long, and it wasn't giving power to his leg. So, without further ado, when should you use a physical therapist? Obviously, it's your first choice before medications, before injections, and before surgery. Do you need a prescription to see a physical therapist in the state of New York? You do not.
Oh no?
No. There's something called direct access law. Direct access law means that you can come to a physical therapist directly off the street. You have 30 days or 10 visits, or whichever one comes first. Which means after 30 days, you need a prescription from the MD. Now, physical therapists are doctors. In 48 states, I think 49 states, we have a doctorate degree, which means that we didn't go to medical school, but we're doctors of movement dysfunction. We understand medicine, and we understand what to look for if we're trained well for red flags and emergencies. So my job as a physical therapist is if I feel there's something that's outright not part of my profession, I will let the physician know, collaboratively. We collaborate with physicians. I appreciate you coming to my lecture. I'm very passionate about helping people with chronic pain and sciatica, and I hope you learned something today. Thanks.
Great.